I'm Paul Hamilton, I'm an orthopaedic surgeon and I specialise in foot and ankle surgery and I work at One Welbeck. The Achilles is a thick, strong tendon that connects the muscles of the calf, namely gastrocnemius and soleus, to the heel bone. It's the strongest tendon in the body and enables you to perform activities such as running, jumping and standing on tiptoes. Common conditions around the Achilles including a rupture, which usually happens around a sudden forceful movement or jumping or sprinting, and patients often describe a pop or a give at the back of the Achilles. The other common condition is Achilles tendinopathy, which is more commonly known as Achilles tendonitis. There are two main forms of this, and one is non-insertional Achilles tendinopathy, which is an area where the Achilles doesn't insert, and the other is around where the Achilles inserts into the heel bone, which is called insertional Achilles tendinopathy. So the most common cause of a rupture of the Achilles is a sudden forceful movement which is seen in jumping or sprinting. Achilles tendinopathy, which is more of a chronic condition, there are a variety of factors that can develop at the same time. Overuse causing repetitive microtrauma that can happen in overtraining without periods of sufficient rest is one of the main precipitating factors. Failure to condition or train the tendon can also cause Achilles tendinopathy. Sudden increase in activity from a more sedentary lifestyle without the necessary conditioning is another reason why you can develop Achilles tendinopathy. Improper training techniques such as running style may also contribute. Poor footwear without cushioning or support, especially in the presence of a foot shape that's abnormal, such as a flat foot or a high arch, may also contribute, along with age or significant deconditioning, meaning the tendon becomes less flexible and less able to withstand the loads that go through it. Surgery is not the only option for treating a ruptured Achilles tendon, and this needs to be individualised for the patient and depends on location of the tear, when medical treatment was sought, and overall health of the patient, activity level and goals of successful treatment, and these should all be factored in. Many ruptures can be treated non-surgically with excellent outcomes, but usually require instigation of appropriate treatment early on to prevent gapping of the tendon. Surgery to the Achilles basically involves reattaching one end of the damaged tendon to the other end of the damaged tendon. Patients often then go into a cast for a couple of weeks, and this is usually non-weight bearing, followed by a boot for several weeks with heel raises to reduce the tension on the Achilles. You then need to start rehabilitation, and this is usually through the physiotherapist. Yes, unfortunately, Achilles tendon injuries can reoccur even after successful treatment and recovery. Causes include incomplete healing, insufficient rehabilitation, or returning to activity too soon. All factors that initially lead to the Achilles problems can also contribute to the recurrence. These include overuse, a tight calf, poor mechanics, and inadequate footwear, and age. Immediate medical help needs to be sought if you feel a popping or snapping sensation at the back of your Achilles, or if you notice a gap in the Achilles, as this allows early treatment to be sought and recovery can be quicker and opens you to more choices of treatment interventions.